Health literacy is about being able to get information about health, being able to understand it, and being able to make decisions and act on that information. I would say that all of us find it hard to understand health information and navigate health services at least some of the time. This can affect any of us, especially if we're unwell, if we're stressed, if we're under pressure, if we're fatigued, which is exactly the time when we're most likely to need health services and health information.
Hospitals are huge, complex. They have their own language, their own rules, to some extent their own behaviour. And it's very hard for people, ordinary people, to navigate through that system.
So to get the best out of the health system, we need to understand it and kind of know how it works.
For me, health literacy is everyone in the public being able to access health supports without having an extra layer of needing advocacy to access them.
It's essentially the interaction between individuals and between the health system.
Health literacy means for me so many things. It's about having an understanding of the particular diagnosis that you might be living with or caring for someone with, but it's also about being able to navigate the system.
Health literacy is knowing, that there's probably a lot of information available that I don't know about and would be beneficial to me if I did, and B, knowing that I can actually go out and ask questions and find it from someone.
I have always been supporting my community and realised that the community has some health literacy problems and not understand how to navigate the health system. So the best way to do is to help them and empower them, because if they can understand what the system is all about and they can then make informed decisions.
The more knowledge that someone has, the more empowered they are.
It's really essential to be able to get the information that you need about your health when you need it and in a way you can understand.
So what happens when we've got low health literacy is poorer health outcomes. It might mean that we end up bouncing into emergency because we haven't followed our asthma treatment plan. It might mean confusion around medicines.
It's really important to safety in healthcare. If we know what we can do to look after our own health, we're much more likely to recover well. We're much more likely to stay safe when we're receiving care.
Often. When the right people were in the room, I didn't ask questions. And then I would go to Dr. Google and try and find the information myself and ended up in a very dark hole.
The time that I had trouble understanding health information was actually when I had my first child. Second time around, I really did go out and I gathered a lot of information and spoke to my healthcare practitioners. I was able to address some of those issues and understand a little bit more about the healthcare needs that I had.
I was diagnosed with one of my health conditions, and my medical specialist told me all about the side effects of the drugs, what should I be looking for, and she also explained to me that the drug was also used in cancer care as well too, so that was a bit scary. I then took the prescription to my pharmacist. My pharmacist then added more side effects and gave me more warnings. Then I brought the prescription home and I opened the box, and inside the box was the information written by the manufacturer. Again, there was different instructions and different information. I was so overwhelmed and so confused. I was terrified and didn't want to start using the medication.
I've had significant trouble understanding health information at various times. As an international student here in Australia, I've often had to call my doctors, just trying to understand what is covered and what care is accessible to me.
When I was told I had hereditary hemochromatosis, I really did leave feeling I had a lot more questions than answers. And so I started searching on the internet, which is what a lot of people do, which wasn't terribly productive either.
There are so many things that health services can do to help people understand health information and be able to act on it.
The language. I had to interpret what the doctor said and then to tell it to my patient, because some of the things that they don't understand, the medical side.
It's essential that patients provide enough information to the health professionals, but it's also important that the health professionals provide enough information back to the patients, but in a format that the patients can understand.
Simplify it for us and give it to us in a more user-friendly way.
Health literacy is both about you accepting that you need to learn about things, but also other people in the system, making sure that the language they use is understandable. I've been trying to do that right at the moment about a system to do with chronic obstructive pulmonary disease. And I went and spoke to consumers yesterday and they said, after you finish writing it up, can you tell us what the system is, because we don't know. Now that's wrong. And that's the responsibility of the system.
Questions, I think, are the bridge between what I know and what the health system offers. I want my doctor to turn her chair towards me and say, do you have any questions? And give me that permission.
There's a propensity to just agree with whatever the GP is saying without actually understanding. So one of the things that could really help is asking the person to just repeat some of the either advice you're giving them or the instructions you have for blood tests, etc., just to make sure they actually understand what it is that you've communicated to them.
What I really would like to see is our health services and our community services working more closely together with an integrated model. Because what sort of happens at the moment is you are in the health space and you get to the door of the hospital and you're kind of waved out. And then you've got to try and find the person who catches you on the other side.
Know your community and know who's using your services. What's the diversity in your community? What's important to people who are coming in to use your services? If you know these things about us, it's going to be much easier for you to give us the information that we need.
I think if healthcare professionals recognise people as individuals and not just their disease, that they get to know what your individual needs are.
Quite often, if we give people time, then they will tell us what matters to them, and that's really crucial.
I think if you're finding it difficult to navigate health services, there are lots of supports out there. So groups like Healthcare Consumers Association in Canberra, or patient support groups, or even just asking your family and friends.
When we share stories about our experiences, we learn about things that might be ahead of us that we need to look out for.
Don't be afraid of seeking other information from other people or other sources, and try and always find sources that are credible, that are trustworthy.
Reach out to others, and I'm sure they have opportunity to help and support you understand that information. I know that people are always willing to help others. Seek help if you can.